My name is Dr. Angela Grace. I am a registered psychologist in Western Canada. Let's have a discussion about the impact of medical gaslighting on individuals with long COVID. So first, what is medical gaslighting? It is the experience of being disbelieved, not taken seriously, and dismissed by medical providers. It is the privileging of biomedical expertise over lived experience. What does medical gaslighting look like? Well, it's when a healthcare provider doesn't listen or interrupts the patient, diminishes symptoms, blames symptoms on age, weight, gender, lifestyle habits, or sexual orientation. It's when symptoms are probably due to anxiety or depression or stress or other mental health issues, saying it's psychological. It's discounting people's symptoms and it's turning them away. What is the patient's experience of medical gaslighting? Patients will often be dismissed with, "It must be psychological. It's psychosomatic. You're just anxious. It must be your childhood trauma. You're too sensitive. You're feeling things you shouldn't be feeling. Oh, it's just aging. It's just women's issues." Patients feel like they must prove their illness and their suffering. If signs of their illness don't show up in blood work or in medical testing, their pain and suffering is often completely discounted. So the patient outcomes of medical gaslighting are a dismissal of the illness experience, delayed diagnosis, and deferred or no treatment. The impacts of medical gaslighting can be severe and life-destroying. Marginalized groups, especially women, Indigenous peoples, and people of color, are more likely to have their concerns or questions not taken seriously, which can be associated with worse health outcomes. Many health issues are reduced to weight, hormones, or mental health problems, essentially blaming the patient. People stop believing their lived experience when the professionals they trust to help them don't believe them. These can be traumatic and life-destroying experiences. There can be missed diagnoses, delayed treatment, missed treatment, medication that is prescribed inappropriately, causing other severe health issues, and poor health outcomes. We really do need to take medical gaslighting seriously. There have been studies about patients with long COVID and their experiences with medical gaslighting. Long COVID patients have criticized medical professionals for not taking their complaints seriously due to physician lack of knowledge about the condition or the general inability of medicine to provide effective treatments. We have a very serious issue of misinformation, lack of information, and lack of training for medical professionals. If you are a healthcare provider in any capacity, you need to learn about the impact of long COVID, the biomedical basis for long COVID, the symptoms of long COVID, and know how to assess it and understand and believe your patients. Patients are constantly battling misinformation, even within the medical community. Patients are left to fend for themselves. Patients are turning to online self-help communities and social media for answers, advocacy, and are even moving away from the medical community. Sadly, there is a tremendous lack of faith that the medical community is going to help those of us with long COVID. Children with long COVID are experiencing tremendous medical gaslighting. There are negative assumptions and stereotypes about unwell children and adolescents and their parents. Parents are viewed as unstable, overprotective, overanxious, and have been accused of making up symptoms for their child for attention. Children are treated with suspicion and are determined to be unreliable narrators of their own health stories. There's a deep-rooted sense of disempowerment. Medical professionals are seen as patronizing and condescending. There's a belief that children with fatigue are just lazy, or have ADHD, or don't want to go to school. They feel dismissed, they feel invisible, and they are often denied care. We need to find ways to prevent medical gaslighting, and this goes for every healthcare provider. We first need to be humble and check our biases. Where do they come from? Why do we have them? What can we do to mitigate them? Please take some training if you need answers to these questions and need a new way of approaching your work. We need to focus on empathy and compassion. We got into this profession to help people, so we need to help people. We need to actively listen to the patient's lived experience. What are they saying about what they're experiencing? We need to believe the patient's lived experience. We need to validate the patient's concerns. We need to know what we know and recognize what we don't know and admit it. One of the most important things we can say is, I don't have the expertise to help you with this, but I'm going to refer you and help you find the people that do. We need to be mindful of systemic issues like time constraints and what is in our scope of practice. We need to know where to refer and where to get the best practice information to help these patients. And we need to avoid assumptions. And that takes us right back to the first step of checking your biases. Patients don't need an answer immediately. Those of us with long COVID know that this is a new airborne viral induced disease that has over 200 symptoms. We know how complicated this is, but what we want is to be listened to be heard, to be validated, and to know that we have someone to go on this journey of uncertainty with us. We need healthcare professionals to help us figure it out. And in the words of Michael J. Fox, the message is so simple, yet it gets forgotten. The people living with the condition are the experts.